What do you think is the importance of NHS workers coming now to strike? Do you think they're in a certain kind of condition that enables them to do this right now?
Well, the trouble is, any strike, whichever line of business you're in, is not good. It's not good for the actual workers. It's not good for the services they supply. The only thing I can look at is say this: this country, and I say this as a Brighton and an Englishman here as well. In the NHS especially, we have this idea, and it's a good idea. It's a great idea that the patient comes first, and that we should not put the patient at risk. And that has always been done in the NHS. But then saying that though, I can only look at other countries, and I'll give you a couple of very, very easy examples of this. New Zealand. The nurses in New Zealand were offered a certain pay rise. It was unacceptable, it was too low. So what did the nurses do? They went on strike. I think it ended up after about 3 or 4 weeks on strike. Doesn't have to be a strike all the time. It has to be a strike possibly 1 day a week, or so many hours every week, people working to rule, not doing overtime. The government realised that they were essential workers. In fact, I would argue they were more essential in working in the NHS than what the government are. If you get rid of the government, we can possibly muddle along. If you get rid of NHS workers, you cannot muddle along. People will be dying and there'll be all sorts of problems. So you take them, they won their dispute. The Irish nurses, locally, just across the water in Ireland, Republic of Ireland that is, they have been on strike over pay. In Finland, which is a country which you would describe as possibly a very Tory-type of country, where they don't really have a lot of unions, the health workers there, again, were unhappy about the pay they got. And they gave the government an ultimate. They said that unless you actually give us a decent pay rise, we will go on strike for an hour every week until you do.
Yeah.
The government nearly collapsed after 4 or 5 weeks, but they got a pay rise. So I think it's a situation, I'm afraid, and I'm sorry, it is about being militant, but it's also about being fair and fighting for what you're entitled to. And I don't think anybody in this country can say that NHS workers don't deserve a pay rise, or care workers, and I say care workers as well because they're in it as well, but I would also say that teachers deserve better as well. Anybody in the public sector deserves better pay, but I would say at the moment, because of COVID, with all due respect to teachers, they are not saving lives necessarily as much as people in the NHS and care homes are. So we do deserve it. I think morally it's correct. I think it's fair. I don't think it's us taking the mick or anything like that. But unfortunately, the government would have it a situation that we can't afford nothing and that we just have to manage. And it's very interesting that at this time when you hear about Boris Johnson saying what he says in government, all the rest of it, and about the parties, all the rest of it, and he himself apparently had COVID and apparently was looked after by a New Zealand nurse and I think a Spanish nurse. Both of them have left the country and gone back home. But I mean, he doesn't seem to get it of what actually jobs people are doing and how important they are.